Good morning and welcome back. A really important conversation here this week. You may have seen this. Chrissy Teigen, who has nearly 11 million Instagram followers, she's a model. She opened up about her battle with postpartum depression after having her baby last year. She was trying to raise awareness about this. In an interview with Glamour magazine, the model explained how the condition completely took a toll on her mentally, physically, even in her work life. Joining us this morning to discuss this is Dr. Catherine Davey. She's a psychiatrist at Swedish Medical Center. Good morning and thanks for joining us.
Oh, sure. Good morning.
This is a really important topic. I think a lot of women are afraid to talk about it too because we're not really sure how to start the conversation. How common is postpartum depression?
So it's kind of hard to tell how common it is because a lot of people don't seek treatment. But they think probably between 15 and 20% of women will have postpartum depression or anxiety within the first couple of years after they have a baby.
And what does it look like? One of the things that Chrissy said when she made her post was, it took me a long time to recognize it because I associated it as being specifically this, and that's not what it looked like for her. So what are the different phases of it that we see?
So a lot of people think that means they want to hurt their baby. That's actually the most common thing I hear. And most women who have postpartum depression never do want to hurt their baby. It often looks like not having trouble connecting with their baby or attaching to their baby, or maybe being too attached and being very anxious about their baby, their baby getting hurt or dying in their sleep or something like that. So people tend to not sleep sometimes, or they stop having enjoyment in things. A lot of people have waited a long time to have a baby, and then they say, why did I do this in the first place? I'm not enjoying this. And that's a pretty big red flag to try to get some help maybe.
Why is there so much stigma seemingly surrounding this? Because from what I'm reading, both from Chrissy Teigen and from other people who have spoken out, is that there's a guilt associated with it. And as a new mom, you're already dealing with all of these new things.
Absolutely.
You're not getting any sleep.
Right.
Why do you think that is?
I think people think they're supposed to be able to control their emotions, and they don't think of it as a medical condition. And I do a lot of teaching around that. Like, this is a real thing. You can't just think your way out of it. And also people think maybe they're not going to be a good mom, and people have a lot of fears about that. And so if they have postpartum depression, they think that fear is actually coming true.
What do they do about it, and how do they know it's time to talk to their doctor about it?
So I would say anytime you don't feel like yourself after you have a baby, you should talk to your doctor and just see if what you're feeling is normal. You should feel normal after you have a baby. You should feel like yourself, but just a little tired.
Yeah.
But you know, if people, the first thing to do would be to talk to your doctor, actually, like to talk to your OB or the midwife, whoever helped you deliver your baby, or primary care doctor, and they can kind of help you figure out what to do from there.
And what if you're a family member or a friend and you notice that your friend seems a little different, seems a little down? I know for me, as someone who doesn't have any kids yet, I feel like, well, who am I to go in and say, you know, I'm really worried about you?
I think that's important, actually, if you're seeing that, especially somebody from the outside or the partner, because I think a lot of women don't want to get help because they're worried that their partner will think they're also a bad mom, or their friends will think that. And so just saying, I'm worried about you. What's going on? Is there a way I can help you? And being very supportive and open to them getting treatment, I think, is the most important part.
I know some people are afraid to talk to their doctors because they associate it with being labeled as a certain thing, or they assume that the treatment is really complicated or involves a lot of medication. So what would you say to people with that concern?
Yeah, it doesn't, any of those things. Sometimes we do use medications, but not for everybody. Most people actually just need some help adjusting their life, like a little more support, a little more sleep, maybe some support groups, or getting out of the house once in a while. Sometimes if we use medicines, people are worried they'll have to stop breastfeeding, and that's usually not the case either. So it's really important to have conversations with your doctor. They might just say, hey, come to this support group or see a therapist or something like that. And it's very treatable, so it's not forever. It's not the rest of your life. It's a few months maybe. It can help a lot with your baby's development and, you know, the quality of life as well.
And hopefully people through this segment and through people like Chrissy Teigen speaking out will realize they're not alone, they're not abnormal, they're not weird, and they're perfectly normal parents.
Absolutely. Yeah. Yeah. And like I said, you can get back to normal and enjoy having a baby, which is really hard for some people to believe when they're depressed.
Dr. Davies, great topic. Really appreciate you weighing in on this. Thank you
so much for having me.
Really appreciate it.